The Care Transformation Project was, we met with our account manager, Jillian, and at the same time when we met with her, Kelly, my manager, and I had utilization management moved into our department. And as we began looking at standard processes and the collaboration between utilization management and case management, we decided that we could really use a consultant to help us get through this and use the guidelines. So she suggested this Care Transformation Project. And about 18 months ago is when we started the project, and it was over 18 months where we did the education, standard workflow. They came into our hospital, looked at our ER, how our case managers and utilization management team functioned, looked at our roles, our responsibilities, met with revenue recovery, and from there developed our standard work. And then we went into the MCG solutions and educating our teams on that. And we did a phased approach because we realized we can't pull 40 case managers in and off the floor to do this work, and so that was very successful. And then the last visit, they came in and did a train the trainer program so that we can sustain what we've learned and what we've incorporated into our work. Our results were we decreased our length of stay by about 0.9, I believe, and we also, our readmission rates we've seen have decreased, although a lot of that is with the care progression and what the case managers are doing with that. And big collaboration now between our UM and case management department and that communication.
Yeah, yes. That's great. Anything with denials? Have you seen any reduction in denials?
That's under revenue recovery. We're working on a denial dashboard so that we can have more data regarding that. But we're noticing that our peer-to-peers are overturning, and our physician advisor is able to use the guidelines when she's doing the peer-to-peers. So we're seeing those things overturn real time than waiting for the denial. So that's been great.
It's validating that this was the right thing to do, and that what we've done in 18 months is really exciting. And so now it's like moving into that next phase of the new things that are coming along and what we can do with MCG and the progression of care.
I think for our Vice President of PostAcute, she was really excited about this transformation project because the work that we did in 18 months, she said would typically take years to do the work that we did in that short time. So she's very pleased with where we've come with the work that we've done.
Wow, that's amazing.
Yeah.
That's exciting.
So we just hope to continue to sustain what we've started and really work with the physicians closer with the guidelines and then our multidisciplinary rounds. So further, we would like to start incorporating MCG in our multidisciplinary rounds so that we can help with the progression of care. And we think that's going to be very helpful to make sure that we get everybody on the same page where the goal length of stay is and what we need to do to get the patient to the next level of care. And the second thing that we'd like to do is continue working on our reports and utilizing the benchmark, getting into patients that were admitted that maybe was not appropriate for admission, so diverting those patients from the ER and not admitting them. So our next goal is to incorporate the guidelines using the rapid recovery guidelines into our ED UM case manager role so that they can use that with the admitting physician to make sure that we are appropriately getting the patients in either inpatient or OB status up front.